Concludes our conference, I'd like to thank Ronan Glynn for making the time to speak to us. There are three more things that I want to do. First of all, I'd like to just express my appreciation for all of the people that have talked to us. I think this has been a really interesting conference. I think it's brought together, it's just shown there's unifying themes throughout how we respond to COVID with research. I think it's been important that we understand the problem. We've seen that from the beginning through to these talks by Ronan Glynn and Jason Leach and Larry Roop. We need to understand the problem. We need to understand how it's affecting our patients. We need to understand how it's affecting our staff so we can respond to those needs. We need to understand the illness itself. How do we diagnose it? What tests are needed? And we need to understand what it's doing to our body. So understanding the problem has been something we've learned a bit more about, and we can take home and consider and see where we respond to that. Then there's person-centeredness. We really need to be responding to the individual as well as the societal problems. We need to understand how it's affecting us as individuals, but when we're developing stuff like the digital technology, we really saw how we've had to respond quickly, and now somewhat we're looking back and finding out how people have experienced it and how we can improve. We can see through the different things that we've applied in society at national level, but also in our digital technology, how input from individuals, from the people experiencing it, has been really important. It's really important that we're person-centred in terms of what we do with medicine, so that we can bring people with us, so we can make it relevant, so we can see the effects that COVID has on individuals and actually listen to them and respond both with how we see them as patients and how we react to them in patients, but also listening to them and hearing what their symptoms are and really thinking what's behind this and finding out what the pathophysiology is behind some of the unusual symptoms we're seeing with COVID are. So it's an understanding the problem, being person-centered about how we understand it and how we respond to it. And underlying all of this theme has been good science. It's been good science that has brought to us all the learning that we've experienced today. It's been good science that Jason Leach and Ronan Glynn have been able to apply. And that's what they're applying to us every day, today in the NEFIT meetings and as we hear about the new variants across the world. And one of the really important things that we can see from the last two talks is how important it is to share this information. It's been really important that we have heard it today so that we can apply it in our own settings, that we can think and do our own research. It's interesting, isn't it, how little small projects locally can have big impacts in terms of our learning. So it's really important that we share that, but not only that we share it among our health communities, but we share it among the general public so that they can be informed. They can be informed of the uncertainties, as Ronan Glynn said, but also be informed of the evidence so that they can make informed decisions and protect themselves and protect society. So I think this conference has been great. Because it's really brought that information to us, and I have learnt such a lot. There's not been a moment I really wanted to step out of the room and make a cup of tea. I've wanted to be here and listen, and I hope you've all felt the same. Before we go, I must say that we've had some fantastic posters. We had got them to put up on the screen, but unfortunately we're slightly blurred. So in the next week, you will find them up on the Research and Education Foundation website, and you will see that they're all listed. So if you could go back to Research and Education Foundation in the future and have a look, we'll have all of those posters up. The posters are up in Sligo University Hospital, and any of the health clinicians and the health workers there can have a look at them. We had a judgment of the posters, and we have 2 medals that are offered to people who've done research and made posters for the conference. And I'm delighted to announce the winners. They are these first people who've done the NCHDs, and they've done this fantastic piece of research into altered bowel habits for colorectal cancer. So congratulations to them, they've received a medal for this. What's interesting about this piece of research is that they've looked at the bowel habit change, and they looked to see if this was a marker of discovering sort of bowel disease. And the interesting thing they found was that it wasn't. And I think what's so important about the survey is they've published something, they looked at something and they found it wasn't it wasn't a marker, but they've published it. And actually that really adds to our knowledge. And there's often, when we do a piece of study and we find that there isn't a positive result, it tends not to go out into the public forum. But this has shown that actually if you're talking about changing bowel habit, it's a small study and there's probably further research needed. But their small study showed that if you have a change, it doesn't necessarily mean there's a bowel disease behind it. So I think that's really important. We also have highly commended studies from the non-hospital consultant doctors. And let me just find the name of the person that's done that. Sorry, 1 second. As someone else said, I've got a Boris Johnson moment, which I don't like to admit to. One doesn't like to be, oh well, I'm sorry, I've gone political there. Okay, so highly recommended from the NCHDs. We got another one which was highly recommended, and unfortunately we'll put it up on our website because the piece of paper that I've got does, oh yes, sorry, it's the Hartel and Paul Packer one, Clinical and Pathological Biomarkers of Metastases in Primary Thoracic Synovial Sarcoma. And finally, we have a second medal offered by the REF and the Medical Board for other health professionals who are not doctors. And the winner of this is McManus, an investigation inquiring about the main concerns of persons who have rheumatoid arthritis in Ireland. And again, I think the key core to this piece of research was that if we listen to and understand patients, we can learn how to support them. It's not necessarily the medications and the treatments that we do that make the difference, but actually it's listening and understanding what effects having an illness can have on you as an individual. Highly recommended were 3 other posters, and I think this reflects the amount of work. There was one looking at stroke, and one looking at dietary intake, and another on the perspective on attributes of care after miscarriage. They're really interesting posters, and I apologise that we had a technical glitch and they're not up today, but I would encourage you to come back and look at these on the REF's website in the next week. And finally, I must thank the people that have been involved in bringing this conference to the fore. I must thank the committee. On the committee, we had people, as I said, from academic institutions in Sligo University Hospital. We had Brian Murphy, who's been monitoring the questions as they come in. We've had Adele McSharry from St Angelis. We've had Rochelle Burns from the Sligo IT. Brian is from Athlone IT, and I've been on it. We've had from the hospital, we've had Karen from the lab, and we've had Maeve, whose surname has escaped me. So they're on the programme, and I'd like to thank them all because there's been a terrific amount of effort that's gone into putting this conference together. I would also like to thank AVA, who've done our technology, and OSD, who have did a great job of putting our website together so quickly as we had it upgraded. But finally, we must thank Susanna Hout. She is our administrator and comms person, and she's not been visible on camera today, but she has put in a huge number of hours to make sure that this runs smoothly. So I'd like to thank her greatly for that. And finally, as chairperson of this conference, I'd like to thank you all for coming. We couldn't put on a conference, it wouldn't be worthwhile without an audience, and I appreciate it takes time of your day to listen to it. So thank you so much for coming, and we appreciate your listening. I hope you've enjoyed it. Thank you.